Welcome to another episode of our podcast at California State University, Dominguez Hills. This podcast is about anything that matters in international education, or it doesn't matter, but anything that relates to international education, students, faculty, administration, marketing. The aim is to promote our CSUDH, to help students who are coming to our campus see what we actually do. And for those of our students who are going abroad, to have something in their pockets about this university so they could use it to promote us, to advertise us, to do all those wonderful things. Today, we have a special guest, doctor and professor and chair of School of Health, Dr. Ricardo Izurieta. Welcome to the program. I know you and I, you just got here at Dominguez Hills, but you really fit in. I'm always impressed by your work ethics. You are always working, Dr. Izurieta, and it doesn't look good for me, who doesn't work that much. Yeah,
it's my passion.
It is, and I know you do a lot of international travel. You work with so many programs overseas, and you did a lot of things during your journey overseas. Let me give the opportunity for our viewers and listeners to know you better. Give us a little bit about your background.
First of all, thank you so much for this interview.
Pleasure, yeah.
Again, I'm Ricardo Izurieta, and my training is first as a physician, MD with specialization in infectious diseases. And why I went into the public health area was because when I was being a rural physician in the rainforest of Ecuador, I saw at 7 a.m. a long line of something like more than 20 patients waiting already for me to be attended.
This is 7 o'clock in the morning.
7 o'clock.
What time do you expect to start?
Well, I usually used to start my work in this rural rainforest at 8 a.m.
8 a.m. So I used 1 hour waiting, 20 people waiting?
20 people already waiting. I used to manage 60 patients a day.
So let me ask you a question.
Sure.
Was that because you're too good, they were waiting for you, or they have nobody else?
Actually, because there was too many of these infectious diseases.
Yeah. Yeah.
And a lot of them malaria and intestinal parasites.
Yeah. Which area is this, Dr. Izurieta?
This is the rainforest of the Chocó, which is between the Indian and the Pacific coast rainforest.
Okay.
Deep rainforest. Yeah. Actually, to go from my home in the capital, Quito, to my rural medicine clinic, it used to take 2 days to travel.
2 days to travel. And Quito, where is Quito located?
Quito is in the highlands.
Highlands, okay.
Highlands of Ecuador is the capital.
So I could see our students now Googling it, see what is this?
Yeah, perfect.
But the information he gave them would help.
So, I said, I have to find a solution for this. And I think, and that's why I would like to tell our students, don't stop learning.
Yeah.
Don't stop pursuing your goals.
Yeah.
And I think I'm pursuing my goals. At this age, as faculty and professor and chair, I'm still pursuing my goals in my life. So I said, there should be something else to do to address these problems of parasitosis, malaria, intestinal parasites. And I did actually my specialization in Peru, in Lima, Peru, at Cayetano Heredia University. My residence in tropical infectious diseases. So I'm an infectologist. And still, I saw, I think I still need something else. That's why I applied for a scholarship from the United States government. And I got that Thomas Jefferson scholarship, a fellowship from the U.S. government to come to the United States to do first my master's in public health, and I did my master's in public health in international medicine, actually, and also management. And then I finished in 1 year the master's, and the scholarship was for 2 years. So my advisor said, why you don't go for the doctorate? And I did the doctorate also at University of Alabama at Birmingham. And I did my doctorate in public health.
Public health.
So I hold the 2 doctorates in medicine and public health. So one foot in medicine and 1 foot in public health. Yeah. And I think that has given me the capacity to, to deal or to address these problems. And I think that the main miracle in the history of medicine and health of mankind, the main miracle is water and sanitation.
Water sanitation,
which was not done by physicians, it was done by engineers. So I have been pursuing this, having working precisely in water and sanitation for decades, also doing a lot of research in gastrointestinal infections, the real diseases that affect and kill our children all around the world. So precisely during this last trip, it was to address the problems of water contamination in the Amazonian rainforest. I am currently member of the water chapter of the Inter-American Network of Academies of Sciences. So, and we want to address this problem in the Amazonian rainforest.
Wonderful.
That's why I was traveling to the Amazonian rainforest a few days ago.
So let me get this straight. In a year now, you have less than a year with us, right?
Right.
So you brought a delegation from Japan, a Japanese university.
Yes, sir.
And I had the honor to meet the delegation. They spoke very, very highly of you. You got them to meet with the provost, and I think the president as well.
With the provost.
With the provost. And then after that, you had a conference on international medicine, I believe, and you were the co-president. And basically, you were the president.
The president.
And this is on our campus. Right. On a multiple occasion, whenever I drop by your office, I always find you working on a program. But then on top of that, you had a scholar from Panama who was here for 2 weeks or 3 weeks, and we were so honored to know her, to help. You did the whole thing. We just provided her an office to study. What else? You are not. Do you have a life outside these activities?
As mentioned, this work is my passion, and actually, I think it was a commitment of life.
Commitment of life, yeah.
Because as mentioned, I was an international student. I came to the United States as an international student, and that's why I tell all our students at Dominguez Hills, please dream. I know your dreams will become reality. And I will tell about my dream. So I used to have I got a scholarship to finish the doctorate. I got a scholarship from Pan American Health Organization to finish the last year.
Of your doctorate?
Of my doctorate.
Yes.
And the scholarship stopped suddenly because, sometimes work organization, the budget stops, and it was 2 months I didn't receive
your money, your scholarship.
Stipend, my scholarship.
Stipend, right.
And I went to my advisor and chair of the Department of International Medicine. I remember his name, Dr. Jose Alvarez from Peru. And I said, Dr. Alvarez, sorry, but I'm leaving. I don't have I don't have even $1 in my pocket, and I'm going back home. And he said, Ricardo, don't give up. He brought a check, and he said, here's the check.
From his pocket?
From his pocket. And he insisted, and I took the check, and I said, okay, it's a loan. When I went back to pay the loan, he didn't want to receive the check that I was bringing to pay him back. And I said, Dr. Alvarez, I insist. And he said, Ricardo, just promise me that when you become a chair, you will do the same as I have done for you for other students.
So I do have one student who may want to take your check, Dr. Izurieta.
Okay, yeah, absolutely. So, he said, you promised me to do the same for your students.
Yeah.
At that time, I wasn't a student. I said, Dr. Alvarez, I'm just a student. Maybe my dream is to go back to my country, work over there. But to become a professor and even a chair is impossible for me. I was thinking, no, Ricardo, I know you. Everybody has the chance, and your dreams can come reality. And here I am. Here I am as a chair, and precisely, I was the director of, and actually the chair of the Department of Global Health in Florida, University of Florida. I came because I want to fulfill my commitment to support our international students, especially minority students, Hispanic. I am an Hispanic person from Spanish background, and we have these minority students, Hispanics, Latin American, African American, that all of you can make reality your dreams.
Now, we're really very lucky to have you on our campus, and I could speak personally. I mean, you are one of the most dedicated to servicing the university. You really care about the students. I know there is something that check you want to give to somebody else, but genuinely, genuinely, I haven't met anybody who is as genuinely interested in the benefit for the benefit of students. And in less than a year, you have made a huge difference in terms of our visibility internationally, the reputation of the program on campus. I just want to ask you, what is it? How do you see students these days? What interests them? How to guide them? We are in a different world. There are so many distractions, particularly those who are pursuing careers in health. Your area of interest.
I always tell my students, because again, I'm a physician and also a public health professional, and I don't evaluate myself. I don't value myself in terms of what's my salary. I evaluate myself in terms of how many lives I have saved, how many lives I have changed, and believe me, with interventions like control of malaria, even elimination of malaria. Precisely this fellow that came from Panama, Tatiana Gardellini, was in the front line of elimination of malaria in El Salvador. And I was the advisor for El Salvador in the elimination of malaria, and they got elimination of malaria. Based on the strategies that we designed, that I designed with Tatiana. And so those have been great achievements, to see that El Salvador doesn't have malaria anymore. I have done the same in my country, Ecuador. I have worked in Costa Rica. I have worked in Peru, controlling these infectious diseases. So that's how I think that don't value yourself just by how much is the salary. Value yourself in what you have contributed to our society.
I can imagine how much benefits the students get from your presence or teaching them. I mean, I would take your class forever, learning about your experiences.
You're very generous. Thank you.
No, it's a wonderful. You not only do your job, but you contribute to the health of human beings, and that's amazing.
And also, I would like to tell the students, take advantage of the new technologies, take advantage of the tools. We have artificial intelligence, we have geographic information systems. So when I start to be an epidemiologist and an infectious disease control epidemiologist, I have to draw maps by hand.
You draw maps by hand?
That the same way as we have, John Snow is the father of epidemiology. you know, anesthesiologists, physician anesthesiologists of the 19th century that controlled the cholera epidemic in London. If I'm not wrong, 1840 something.
Yeah.
So he has to draw, and I for my students, in general the students, read a nice book, The Ghost Map.
The Ghost Map.
Ghost Map.
Oh.
You know, it tells the whole story, very scientific. It's not science fiction.
Yeah.
In a very scientific way, describes, but in a way of novel, the work of John Snow, the father of epidemiology. And I say, you know, he was drawing maps, and I was in the 20th century drawing maps also. But now you have geographic information systems, satellite images, you have even drones. In my work currently, in my projects of control, I integrate satellite images, I integrate GIS, I integrate remote sensing, I integrate drones and even artificial intelligence to map the distribution of infectious diseases.
So if we stay on that point, how is that sort of, do you have programs like this who do this kind of things that you mentioned in radiology, for example, imaging, some of the programs that use technology are sort of start to integrate artificial intelligence?
Right. So currently, you know, artificial intelligence and this kind of algorithms, you know, are being used in all levels.
Yeah.
Even, for example, I can say that I have developed a new strategy of control of infectious diseases, which is called, actually I shared the authorship with Dr. Ben Jacob from University of South Florida. With Benjamin, we have developed what is called Seek and Destroy. So Seek and Destroy, the approach of controlling infectious diseases, has two levels, the macro and the micro. In the macro, with satellite images, drones, we identify breeding sites of the Anopheles mosquitoes that transmit malaria, and the drone itself inoculates a bacillus, a bacteria, Bacillus turgensis iralensis, that controls the larvae of the mosquito in the breeding sites. And this project we have right now in Uganda. So it's not just in developed countries, it's in developing countries. Yeah. And the micro is mainly the early detection of the malaria parasite in the blood of the patient. And we're also using kind of artificial intelligence to detect the parasite in the blood because it can be faster, it can be more accurate. So we can use those tools, you know, to increase our accuracy in the detection and controlling of these diseases. So that's the way how.
So I know from knowing you that you do work with students. In fact, the research scholar who was here, you were very instrumental in guiding her through the process of dissertation writing and things like that. Can you talk a little bit about your experience getting students involved in your area of research?
Absolutely. You know, I think that definitely the best way for our students is to, at some point, whatever they learn in the classroom, to apply in the practice. And that's what I like, you know, to work. And sometimes I work one-to-one with the students in research, and especially in the master's and doctoral level. And some undergraduate students also. I have taken as a mentor many of undergraduate students, and this is very important because they can apply in the practice what we give them in the classroom. In the case of this fellow from Panama, she's doing a great research doctoral study on precisely managing the anemia that malaria causes after the treatment. And she's implementing a program to supplement iron for those women that has recovered from malaria in her country.
Wonderful. Can you tell us a little bit about your School of Health, the programs, the offerings, some of the major highlight of the department you chair?
Absolutely. So our School of Public Health and Health Science relatively is new. We have programs in the undergraduate level and the graduate level. In the undergraduate level, we have two main concentrations, one in community health and another in healthcare management.
Yeah.
We have done recently some changes in the curriculum to articulate our Bachelor in Sciences with concentration in community health and healthcare management to articulate with the associate degree diplomas from community colleges.
Mm-hmm.
So our aim is that those students that come from community colleges with the first 2 years of post-high school studies, they can finish their Bachelor in Sciences here, taking year 3 and 4. And we have done a tremendous work during this year. Everything is just being approved, and this will facilitate, for students who want to continue their career, to finish the bachelor's and even think in the programs that we are developing. Actually, I have developed already the Masters in Public Health with 3 concentrations in community health, in healthcare management, and epidemiology that it has been already submitted to be approved, and having here at Dominguez Hills.
That's amazing. Just for our international students, some of them are familiar, but the community colleges, these are sort of half of the university's time to get a bachelor's degree. You do your first 2 years there, you get an associate degree. A lot of people transfer from community colleges to the university for a 4-year degree. We have a lot of international students who are sort of go the same path. It's for several reasons. It's for, it's cheaper. It could be, some community colleges have wonderful programs.
Right, I totally agree.
Yeah, so your program, finding a way to have those students come to finish with us is I'm sure it has a lot of positive things.
Absolutely, yes. That's our aim, as mentioned. Myself, I have not stopped learning. Learning.
Yeah.
And we want to give the opportunity to these students, that have these degrees in the community college.
Yeah.
If they want to continue
they could,
their process, academic career, here is Dominguez Hills. We invite them,
Yeah.
It's open. Our doors are open. And we have done all the curriculum changes to make it easy to transfer of this.
Transfer, yeah. We talked before about some of the new programs or this program that have been there for quite some time, for the last few years. Can you talk, for example, about radiology, which is, I think it's online only, right?
Yeah, it's online.
It's online.
Right.
But, we have students, international students, who might want to do that
right.
online. Your upcoming program, Master of Health, is that so? Yeah? Public Health, I'm sorry.
In public health, yeah.
Yeah.
Yes, in the graduate level, precisely, we have, besides the new masters that we have developed, and actually the new masters that we have developed, and we hope that we can start with the first cohort in summer 27. Besides that, we have our masters in radiology and image, which gives post-baccalaureate training in radiology and research, managing of services in radiology, data management, etc., for these professionals that are in this area of radiology. But also we have which I think is a wonderful program also, the orthotics and prosthetics program.
Tell us a little bit. Tell us a little bit about that.
This is a wonderful program. Is recognized as one of the best orthotics and prosthetics programs, not just in California, in the whole United States, and even recognized internationally.
And we have a doctorate right now.
We are in the process of that. Yeah. Right now, there is a master's in orthotics and prosthetics with different specializations. One in orthotics, the other in prosthetics. And they just not train the students, but they offer also services for people that need this kind of prosthesis or orthesis. And actually, most likely, we're going to be, we just are finishing, I think, this November, the new building that we have, because they used to be out of the campus, and now we brought them to the campus. The new building that is close to the Galaxy Stadium, close to the College of Continuing Education, is a new building for the Institute of Orthotics and Prosthetics, and is the new house for our program. And most likely we will be the ones that will provide the services for all the athletes that will compete in the Paralympics of 2028, Los Angeles.
Oh, they will be here, right?
Yeah, it will be here. Yeah. And we are the institute that will provide those services for those Paralympics athletes. You know?
And I think moving it and really in a building that is waiting to be open, the construction is underway. Yeah. I think it's supposed to open in February. Some of the
actually, the building will be finished November, first days of December. But I think the building itself, but we have to place equipment. We have to. It's a lot of equipment.
And then you have the bureaucrats showing up, the health permits.
And so once we place the equipment and all these things, I think the official will be.
I know there was a cap, because usually they accept a cohort, right?
Yeah,
that's how they accept it. There was a cap at one point of 24 students and that speaks, number one, to the quality of the program, because only few are accepted the program. But there was also some in the old space, a practical way of sort of working with the facilities you have. So in other words, the facilities that we had before were you could only have 24 students, and then I added to 30, but it's still limited space. Is the new place has more space availability, or is it this what the program is supposed to be?
Still, we have this cap of students, because as you know, as in any program, we have to consider the physical infrastructure, human resources, the availability of patients to the students can see. So we have this cap up to 30 students. And I know that our faculty in the orthotics and prosthetics, they work very hard. And they say that they will manage this with the new building. But also we have seen other facilities like classrooms in other buildings that can be used for the standard classes. And so actually they will be on campus already functioning beginning December. With the students and faculty, all of them.
No, that's amazing. And I had the opportunity to visit the other facilities, because at the time the college, as usual, your college is very, very cooperative and works very well with international students. At the time, I think they created space. We had contracted with Saudi students, and they were here for thanks to the extension of space and hours as well for work. We were able to get them. Any idea about the requirements? Do you need any requirement? For example, you talk about transfers from community college. Are there any special requirements that the School of Health or the School of Health has?
Actually, we are making easier. We're making easier the process of transferring, and I always tell all the students in the school, and even from other colleges, if something is not working, you have a challenge, in your process of registration, in your process of application, whatever, just come to my office.
Yes.
My office is, as you know, is open, always open. There is no need of making a schedule with me.
Dr. Izurieta, I'm trying to keep up with you, but I can't.
And so they are welcome to come. We are here to serve our
That's
students.
amazing,
And actually, the Masters in Public Health that we're developing is going to be online. So that will also facilitate, for even students anywhere in the world to take online these Masters in Public Health.
I think we're coming almost to the end of our program. But I want to ask you a question about how we are preparing students. Everything is becoming digitalized, and now it's artificial intelligence. How do you see the university moving in that directions? In other words, my concern is that the kind of program, universities are always slow in developing programs. I mean, we don't set trends. We report about trends, and then we try to find a way of how to meet the needs of society. But the market is tough, the new market. I mean, we're all this skill set, and health is one of the areas that is very, very much affected. I think your work in censorship, in censoring GPS, connecting medicine with geography or other is amazing. That's where I think we're shifting. I wonder if you could talk a little bit about how we are as a university preparing a new program for this age that is coming up or that we are experiencing.
I'm going to tell you, Dr. Salhi, what is maybe my way of thinking or my personal criteria. Of course, I always respect my institutions, my universities. And when artificial intelligence came a few years ago, I was in Florida. Some of our faculty in Florida were against, allowing using artificial intelligence to our students, and I was the first one that said, it will come. If the university doesn't embrace or doesn't, embrace this, the private sector will do. And you know that the private sector right now, actually, and I said, the private sector will ask our students if they know how to manage artificial intelligence. Because for me, it's a tool, as we have mentioned, it's the same as calculators. When calculators came, some institutions didn't want the students to use calculators, but we finished, everybody uses calculators. So I think that what we need in general, not just skills, but the university in general, need to establish clear policies and especially teach our students how to ethically use artificial intelligence. And for example, I used to teach immunology in Florida, and immediately I detected one of the essays, done by artificial intelligence. I said, sorry, but at some point, artificial intelligence can become schizophrenic. So be careful, you have to be, it's a tool, but it's the human that need to be analyzing and seeing that, controlling that what you are getting is right and is correct. So it has to be used in an ethical way. I think that we have to, as humans, we have to precisely be more analytic and use that as a tool. That's
amazing. Any thoughts?
Any thoughts? Again, our students never give up, and your dreams will come true. And this university, I'm happy to be here. I'm really happy to be at California State University because it matches my values in terms of serving our students that maybe are the ones that need, some kind of inspiration or some kind of I would say I'm not a model, because I also have defects. But I can say that whatever you dream is possible. And here I am, to help you guys. I have been, interacting with students and engineers here. And it's amazing how, we can connect and just, I will say that maybe myself, you're still young. I'm going to retire.
You're going to retire,
But you guys, our new students, you need to take the post. So I need to pass the post to you guys. And I need you to be prepared when you receive the post of this marvelous work or this discipline of public health.
Dr. Izurieta, we are so lucky to have you. Your students, our students are lucky to have you. We are going to make dreams a reality. Unfortunately, we came to the end of our program. Thank you so much for your presence. We learned a lot about you, and I'm not surprised that you continue to work. Until next time, you are watching, or we just come to the end of our podcast this week. We did a journey with Dr. Ricardo Izurieta, a professor and chair of the School of Health. Until next week, have a good week, and bye-bye.
Thank you, Professor.
You're welcome.
Saki.
Yeah, it's a pleasure.
My pleasure.
Yeah.
Thank you so much for having me here.